Hello, this is Neil Baum from New Orleans, Louisiana, and I am the medical advisor for Vanguard's Communications. I would like to take about 7 minutes to talk with you about a topic that is often overlooked in most medical offices, and that is telephone etiquette. I'd like to begin with a story about the famous basketball coach at UCLA, John Wooden, who emphasized the basics. And on the first practice of every year, he had a team meeting where he showed them the proper method to tie their basketball shoes. He felt that that was part of the basics of having a winning team. And the telephone is part of the basics of having a successful medical practice. The current situation is that the telephone is often the patient's first encounter with your medical practice. You'll be judged instantly on the patient's initial phone call. If the phone is answered, "Doctor's office, please hold," that's hardly an atmosphere of caring, compassion, and empathy, and is not going to make the patient look forward to being part of your practice. In this video, I will cover the importance of the telephone and give some guidelines that will apply to anyone who answers the phone. Beginning with having a smile, because the smile is transmitted to the caller. The way that I motivated a smile in my office, I placed a mirror in front of the person answering the phone. And that way they could get reinforcement of their smile by looking into the mirror. You'll also notice on the receiver is a reminder of telephone is equal to an opportunity. It's an opportunity to create that good first impression. There's a proper way to greet the caller when answering the phone, and that is to identify the practice. The person answering the phone should identify who they are and offer to be of assistance. I think it's important to use the patient or caller's name as frequently as possible. Our name is the most important word to each of us, and we have multiple opportunities to use the caller's name during each and every phone call. I recommend avoiding the on hold response. Always ask the caller, "May I put you on hold for just a few moments?" Wait for the caller to answer and then push the hold button. I want to talk about preparing for the first visit. You want to relate the following information to the patient on the phone. You would like to direct them to the practice website. You should encourage them to complete their demographic, insurance information, and the health questionnaire before they come to the office. You want to tell them what they're to bring, which includes their insurance card, their Medicare card, any previous laboratory tests or imaging studies that may have been already performed. Tell them the cost of the visit, the deductible and copays that they would be responsible for, and inform them of your cancellation policy. I think it's important to estimate for a patient how long you anticipate that each visit is going to take. Certainly a new patient with a problem such as blood in the urine is going to take longer than a follow-up patient who has a urinary tract infection and just needs to check their urinalysis. If a patient you recognize is going to need a much longer visit, you might want to consider scheduling them at the end of the day. I think if you're going to ask for a patient to give a urine specimen, I think it's important to tell them and to encourage them to consume some fluids prior to coming to the office and be prepared to give a specimen. At the end of the call, I think it's a nice gesture to ask the caller if they have any additional questions. This is your time to repeat the day and time of their appointment. And again, make an effort to use the caller's name one more time during that phone call. So what's the bottom line on phone etiquette? Patients are going to be judging the practice on that caller's initial phone call. The telephone is that opportunity to create a good first impression on the caller. My take-home message is you don't get a second chance to make a good first impression. I'd like to end this video with a quote from that famous coach at UCLA, Coach John Wooden, who said, "It's the little details that are vital. It's the little things that make big things happen." Well, I hope you have enjoyed this video and received some suggestions on the importance of telephone etiquette. If you would like a copy of the slide deck and or the white paper on proper telephone etiquette, you can reach me at the email address shown on this last slide. Thank you.